ovarian hyperstimulation. This is a situation whereby your ovary responds strongly to some certain medication used to stimulate or used to induce ovulation. It happens when your ovaries produce so many follicles in response to the stimulation drugs used. And these stimulation drugs used are letrozole, clomid, and injectable gonadotropin. These medications are ovulation stimulating medication. Now, why does this happen? This ovarian hyperstimulation, why does it happen? Or who are those women at risk of developing ovarian hyperstimulation? Number one are women with PCOS. If you have history of PCOS or you have PCOS even, you are at risk of developing ovarian hyperstimulation when you take all these ovulation induced medication without guidance, without doctor's prescription. Now, when your body produces excess estrogen level, you are going to have ovarian hyperstimulation. Now, when you overdose yourself with this medication, letrozole, clomid, this ovulation inducing medication or ovulation stimulation medication, whatever, when you overdose yourself with it, that is when you have ovarian hyperstimulation. Now, when you also have history of high response, like maybe you have taken ovulation induced medication and you have ovarian hyperstimulation. If you have history of having ovarian hyperstimulation, then you are also at risk of developing it again. If you have taken all these ovulation induced medications and you are having any of these symptoms, number one is lower abdominal bloating, fullness around the waist. You are gaining weight because of water retention. Okay, pain, pelvic discomfort. Then you go for a scan, you notice that your ovaries are enlarged. These are the symptoms that you are now having ovarian hyperstimulation. And this is as a result of taking all these ovulation-induced medication without guidance, without doctor prescription, or when you are taking it overdose. And it is very dangerous and it's life-threatening. When you finally find out that, okay, after taking this ovulation-induced medication that you now have ovarian hyperstimulation, what will you now do? First, you're going to work with your doctor and you're going to stop taking any ovulation-induced medication. You're going to stay hydrated. You're always going to monitor your ovaries. You're going to switch from all this aggressive ovulation-induced medication to a gentle one. You're going to pause any medication, letrozole, clomid, with the injection that you're taking to induce ovulation. You're going to stop everything entirely and you're going to work with your doctor. Do you understand? So, if you notice that you are having any discomfort in your abdomen after taking clomid and letrozole, go for scan.